Thank you very much to Georgie for this opportunity to share my story with you. I'm a secondary school teacher, so it feels quite strange to address a group of people who are actually listening to me. And I haven't got to say, 3, 2, 1, are you listening? I'm still waiting, so this does feel quite alien. So thank you for being an attentive audience to start. So my story, it starts in October 2011 in the first trimester of my first pregnancy. Towards the end of the second trimester, which was 4 weeks before my due date, the leg pain in my left leg became more severe. The GP diagnosed SPD and I was told it would go away after delivery. Walking was very painful and the due date felt like a destination. And I started to forget that I was actually really having a baby at all. And it sort of became the day that the pain will go away, which isn't usually the strapline for birth. On the 12th of May 2012, when my son was born, after delivery, the pain was so much worse. So it was almost to the moment that the baby was delivered, the pain was just ramped up, hugely. So I couldn't stand, I couldn't pick up my baby, I couldn't get to the bathroom, I couldn't sit up to breastfeed, so I breastfed lying down. I was drinking coffee and tea through a straw. My mum fed me Weetabix, lying down. And it was just a very frightening time. 2 days later, a doctor confirmed that I just had lower lumbar back pain. And I kept saying, what about my legs? But it was, the back was the problem, supposedly. So he said, you'll be fine in a week, go home, it'll all settle down. They said about relaxing, and it was pregnancy hormones, and it would be better, by about a week. So again, it became a date that I started fixating on. So this is a glamorous photo of me. And this was walking from the bathroom with the help of a Zimmer frame. So this time in hospital was pretty miserable. My husband wasn't allowed to stay overnight on the ward, so when he left at 9 p.m, it was a really lonely, long, miserable night. I couldn't kind of get up to go to the loo myself, let alone look after the newborn lying next to me. I also began to feel like they thought I was wasting their time. I don't know, maybe they thought the stay was fun, I'm not sure. But the midwives, I felt like they were getting a bit impatient with me. It was over a weekend as well, so there weren't many doctors around. And every time I rang the buzzer, I felt like a real pain, which I had to ring the buzzer all the time. So this is 3 days after, and so I was discharged from hospital with a Zimmer frame and a baby. So what followed, the weeks and months were pretty miserable and continue to be. It was very isolating. I became self-obsessed with my pain. I was in my own world. I particularly remember struggling with visitors sort of cooing over the baby, and I just felt very disconnected. I felt just in my own space, not really present at all. And I wish that people could see the pain, because that was one of the biggest things for me. I thought if I'd had a bandage around me or something, it would have made everything easier. But people weren't interested, and why would they be? Because I had this beautiful baby. I looked totally normal, and that was the hardest part, I think, because people say the obligatory, "Oh, you look wonderful. You've lost loads of weight in 3 days." And over the next 4 months, I found that hard, because I didn't know. Looking good, I just didn't understand you saying that to make me feel better because I've had a baby, and it just was all kind of mixed up with having had a baby and being in this pain. So over the next 4 months, I was prescribed various medications. So between this, breast pads, nipple cream, dirty nappies, I was really wondering what on earth had happened to me. I had a great NHS home physio who was very supportive, and the first person who took time to talk to me about everything. And again, you know, start to see patterns emerging now. And I recognise now this was part of the reason I would feel really positive after she left, after her weekly visits. I had tried massage, osteopath, hypnotherapy, kneeling chairs, Crocs with fur lining, cushions. I carried around a bag with a cushion in it for months. So I had tried sort of everything. Then when I had the MRI scan, there was the severe disc extrusion and surgical referral was advised. In 2012, in July 2012, I was also diagnosed with PTSD, and I had some NHS counselling which did help me process the anger that I soon realised I was feeling with the hospital, really. And I felt I'd been ignored, I felt that nobody was interested, and it was sort of because of it being mixed up with having had a baby, I think. So during this time too, just to kind of add to what felt like a very full plate, my mum had been staying to help me look after the baby, which she and my in-laws were brilliant and obviously spent more hours perhaps, well definitely, than would have been ordinarily, helping me. But one morning my mum collapsed and she had a seizure which she'd never experienced before in her life. So it was very frightening for her, for me, for all of us. But I recognise that now, that this was obviously a result of the extreme fear and anxiety that she was feeling about me at that time. But that's not my mum's story, I just thought I'd add that in there. The story does get more complicated, and so I'll whiz through this bit a bit. But all of this added to the feeling I already had of feeling ignored and the tension that was surrounding me and just having something done, I think. But in August, I received a letter asking me to call St George's Hospital for an appointment, so I was kind of excited about that, rang them, and then they told me that, thank you for ringing, but there are no appointments available, which was quite strange when I had to ring to get an appointment. But this did become a tipping point for me, and I felt like I was just a hopeless case, and I did think that I'd be lying flat on my back in pain forever, and this was me at 30, no, I was actually 29. My heart was really starting to break with the frustration of it all. I was told that my paperwork had slipped through the net, I wasn't on the system, so then in desperation I had an epidural lumbar injection at a private hospital in August 2012. This gave me no relief at all, but I did enjoy my own room with a TV and a silver tray with cake and tea and a bit of peace for a few hours, so maybe it was worth the money. But then, to cut a quite long story short, I did then have microdiscectomy surgery on the 9th of October. So this is me on the second night home after surgery with 5-month-old Barnaby. The overused, but it was said with a lot of intention to be kind, but I found a very difficult phrase that friends and family used to say to me, well, at least your baby's fit and well, which of course I couldn't be more thankful for, but it became an empty sentence. It became a sentence that really made me think I have to just shut up and get on with it now, because everyone's getting bored of me, I don't know what to say, and that's the best that, you know, we can come up with really is giving, you know, being glad that baby's okay. And I was hugely, but it just, well, what about me became the phrase in my head in response to that. The next few months, there was not much change after surgery. I found the other day my kind of diary, which I was writing, where after the surgery I analysed the pain every day. So I scored it every day, and I analysed, was it better, which area was it in, and what made it worse, this chair, that chair, and it was all all rubbish really, but then I did notice that there became a variation on a day-to-day basis, which I started to realise was quite illogical, which would be, you know, having had a better day with seeing a friend that took me out of myself. And I have written about that in my diary, but I haven't made the connection. So I was discharged at this point by the NHS physio, but my kind of need to see a weekly physio continued. And obviously that was a form of support that I leaned on. And I quickly replaced her with a private physio. And she worked in a very holistic and therapeutic way. She did talk to me about the importance of relaxation and relaxing my muscles. She told me about mindfulness for the first time. I'd never heard of it. And this all really began the right journey towards a mind-body recovery. So I have a lot to thank her for. At this time, as well, there was financial pressures with paying for a lot of this treatment. We were also paying for a student to help me a couple of hours. I had help from a charity, Home Start, as well, 2 hours a week. So I was experiencing pressures also now. The surgery was kind of done and dusted about returning to work. And I had a head teacher who sadly was unsupportive and not sympathetic at all, which meetings with her and emails, and it all kind of almost all became worse than it was before the surgery itself. I do recall a really negative occupational health therapist who I must have seen about 3 times, and I really hated her. She was just really grim, and she just dragged me down, and I felt angry after seeing her. But I remember her saying to me, you know, this is you now, and you're likely this is going to be the pain for the rest of your life. And she kind of, it's like she tolled a bell and said, you know, this is failed back surgery, and that had been the biggest fear that I'd had all along. So yeah, that was a low point. So what changed, I think, probably when I was sort of looking at the journey, it was a very slow process, and it's sort of hard to identify, but I read How the Mind Can Heal the Body by Dr. David Hamilton, and it was the first time I'd heard ever about visualizations and the power of positive thinking. And I read about Dr. Sarno at this point, and like a lot of people, discounted it and thought, no, that's something quite not right there. But I know many people do that in the first instance, and I definitely came back to Dr. Sarno, but only really after speaking with Georgie. But having then read about Dr. Sarno, it led me on. I saw a blog, and then it somehow, through lots of searches, it did eventually lead me to researching further and finding Georgie's website. Funnily enough, whilst waiting to see the occupational therapist. So yeah, it was a blessing. But I strongly remember the 15-minute Skype appointment with Georgie, where it sort of felt like birds started singing, and she told me with sincerity as well, like I really believed it, that I can live a life without this pain, which I'd never ever heard before. So progress, 6 months after surgery, my husband Barnaby and I made the journey from London to Huddersfield to have an appointment with Georgie. And I say journey in that sort of, it was very monumentous, because this meant me sort of lying flat with my seat tipped back. I don't think I'd sat in the car for over a year. So I was just lying like a corpse. And I felt a sense of pilgrimage, as did my husband, I'm sure. So it was snail's pace, but things did change. My mood was improving. One memorable moment was meeting a friend where I had to bus to get there. And whilst waiting for this, my leg pain was stabbing as usual. The pain continued whilst on the bus, but I soon recognised and listened to the fear. And I could hear myself saying, I shouldn't be on this bus, I can't lie down, it's going to get worse. I told myself that this was fear talking, and then, lo and behold, I noticed 20 minutes later, after meeting my friend, the leg pain had dropped considerably. So from here, I stopped obsessing about the term pain-free and focused on what my husband kept referring to as marginal gains. He's a PE teacher, so hence the sporting reference. So from following the SIRPA programme, I recognised that I was a classic personality type to suffer with stress-induced pain, and I reflected on certain triggers surrounding birth and my family history, which unravelled a lot for me. I used Georgie's techniques in the SIRPA programme of the timeline of pain, journaling, goal chart, and a weekly plan. I found that focusing on positive affirmations really, really helped. And that was a big thing when I started to go back to work then in the March. So bigger life goals, life became more positive, and I was slowly becoming myself, not just a blob of pain. And we achieved some of the life goals that you can see here. And soon after having moved out of London, the biggest life goal was achieved, which I never thought would happen, and it was a massive, massive step for me, and that was Reuben. So he was born last December, and that was, it was job done as far as I was concerned. And I was not walking around with a Zimmer frame, but holding a baby in my arms, and just like I expected to be. So there are sometimes that I go, when I went back to work this September actually, that I have to remind myself of what my personal goals I've achieved and how I now live my life without that excruciating leg pain. Georgie's strategies have taught me to reflect and live in the moment, to look outwards and up, out of my own head and thoughts, which I wasn't very good at doing before. And here they all are, and I'm ever so grateful for having learnt so much, and for my wonderful loving family that 5 years ago I would never have imagined would have had 4 of us in it with 2 children. So here I am, confidently at last able to say the words pain-free. So thank you.